start with some startling statistics out this afternoon when it comes to overdose deaths in Cuyahoga County.
Those numbers are sadly approaching a record for a single year. The county medical examiner tells 3 News fentanyl is the biggest driver here of this crisis. Our Kaitor K sat down with him today. Kaitor joining us live now from the medical examiner's office with a breakdown of these disturbing numbers. Good afternoon, Kaitor.
Good afternoon. So it was in 2017 that Cuyahoga County hit its record with 727 overdose deaths. Today, medical examiner Dr. Thomas Gilson tells us that they are projecting 722 deaths for this year, which would be the second highest year that they have on record. Now, Dr. Gilson told us straight out that this year is a very bad year. He gave us a chart, actually, that shows that 65% of their projected overdose deaths would be due to fentanyl. And he says fentanyl has been the major driver of drug fatalities since 2016, when the county's total overdose deaths jumped to 670, 400 more than the year before.
That's the equivalent of about 4 jets crashing into Lake Erie every year. And we look at that, and if we saw that, we'd say, well, we better build better jets. This is a problem that really is worth our best effort. I would love to see it fixed. I certainly think, like many people in Northeast Ohio, I have had, close friends, family members lost to this crisis.
We asked Dr. Gilson if there's any hot spots of where this is happening. He said it's really going on everywhere in the county, but they are seeing more overdose death cases on the east side of Cleveland. He says it's not just pure fentanyl causing the deaths, but fentanyl mixed with cocaine, heroin, and other drugs, and the user being unaware that their drugs are laced with it. Now, anyone struggling with drug abuse can call the national hotline at 1-800-662 help. And coming up at 5, Dr. Gilson gives us his #1 advice for anyone that is consuming illegal drugs.
Kaitor, does Dr. Gilson have any outlook for this next year? Does he anticipate things getting better?
At this time, he has no outlook for next year, but unfortunately, he does not expect this problem to get much better. He says it's very unrealistic to think that the numbers can dip back to where they were pre-2016 when fentanyl took over in the county.
And the problem with this crisis is it can affect anyone, any kind of family. It does not discriminate, and clearly a huge problem right now in Cuyahoga County. We'll look forward to your report coming up at 5. Kaitor, thanks.